Hi, everybody. Welcome. Wednesday at 7:30, Dr. Harry's Healthy Corner. Today's topic, diabetes type 2. Is it possible to be too sweet? So we did a little video before and it seemed it wasn't working that well. So we're restarting the video. For those of you who missed that little excerpt, just please go back and check it out. What we basically talked about so far is diabetes type 2, that there's a difference between diabetes type 2 and diabetes type 1, but the one we're talking about today is diabetes type 2 because it is the most common form and it's usually secondary to lifestyle issues. So, diabetes type 2, what is it? Well, diabetes is primarily when the body has a challenge metabolizing glucose and insulin. And so glucose is the primary form of energy that the body uses, is the primary sugar that the body uses. And so therefore, what usually happens is that insulin, the special chemical in the body, helps glucose, the primary form of energy, to be put into cells, and the cells use that as energy so the body can function normally. When this does not happen the way it's supposed to happen, then sugar or glucose has nowhere to go, and so then it becomes elevated or increased in the blood, and then this can then damage other organs. So it's important to know that, a couple of things. It's important to know that the factors that are involved in diabetes are a lot more than insulin. So for example, did you know that the liver is the primary storage of excess blood sugar? So let's say you've had a meal and the body has used all of the glucose it needs for energy to help you to run around, etc., and it has extra left over. It will store that in the liver for future use. And for future use means on those times when you're not able to eat in between meals, so that your body has a storage site to dip into to access that sugar. If there is too much sugar running into the in the blood and the liver becomes full, then what happens is that special chemical insulin is now able to, what it will do is now able to take that that excess energy and store it in fat cells, and also it might start damaging the liver as well and contribute towards something called fatty liver. So that might be a lot of information for you, but that's primarily what happens. So what we want to talk about today is diabetes. What is it? Is it treatable? Is it a treatable condition? Is it reversible condition? Can it be cured? Is it something that you need to be on medication for all the time? These are questions that we wanna answer. Who is at risk for diabetes? What are the symptoms of diabetes? How does your doctor diagnose diabetes? These are all the questions that we want to answer today. And of course, any questions that you have, we absolutely will answer those as well. So we talked about a bit about what diabetes is in a simple format, and primarily what it is, again, is your body not being able to use insulin and sugar appropriately, and so the blood sugar goes up. Did you know? So then we talk about pre-diabetes. So what is pre-diabetes, right? So because sometimes people get confused and they're like, I don't know if I'm diabetic, I don't know if I'm pre-diabetic. Well, pre-diabetes, there's several things that fall into that category of pre-diabetes, and it primarily means, I think, what we're saying at that point is that the body doesn't seem to have all the changes consistently that would lead to the official diagnosis of diabetes. But please be aware that pre-diabetes is just as concerning as the diagnosis of diabetes. So here is where you might have something called insulin resistance. And so remember we talked about insulin. That's a special chemical that helps the body to use blood sugar well. Well, insulin, think of insulin as a key, right? So insulin is like a key, it fits into the lock and it unlocks the cells so that the sugar can go into the cells so your body and the cells can make energy out of it. So insulin resistance is when the lock, the key is not fitting so well into the lock. So the body's response to that is, well, maybe we need more keys. And so it starts making more insulin. And so the insulin is increasing and hoping that it can get the cells open so that the sugar can fit into the cell so you can make energy and the sugar is not floating around in the blood causing a lot of damage. But what happens when that happens, when insulin level starts increasing and increasing and increasing, what the body does then is very interesting. The body then starts decreasing the amount of locks that insulin can fit into. So it starts becoming numb to insulin, so to speak. Think of it this way. For those of you who have teenagers and you're screaming, if you're constantly screaming, you notice when you're yelling at them all the time to do this, clean up your room, wash dishes, do your chores, do your homework, they eventually just tend to tune you out because they're so used to the sound that there's no response to it. So that's ultimately what happens with insulin resistance. But the concern is that an excess amount of insulin can increase inflammation. So insulin is good because it helps you to manage blood sugar, but if the level is too high, then it's bad because then it increases inflammation. And inflammation, as we know, contributes towards a lot of chronic illnesses. And the concern, again, chronic illnesses such as heart disease, hypertension, Alzheimer's disease. These are all strokes. These all fall into the possible chronic conditions that insulin resistance and diabetes can increase your risk for. So you can see why it's a little bit concerning that many people feel that perhaps a diagnosis of pre-diabetes is not as concerning as a diagnosis of diabetes, because rest assured that it is, because it can cause similar concerns, right? So what are some of the symptoms of diabetes? For those of you who are being challenged with diabetes yourself or know someone who has diabetes, and like I said before, there are estimated right now, about 100 million Americans have diabetes, and of course more are familiar with people who do have diabetes. The symptoms are this: increased frequency of urination, right? So you find yourself urinating a lot, and this happens because the body tries to get rid of a lot of that sugar that's in there. And so because sugar is sugar has the ability to pull water to it, when the body is trying to excrete that sugar into the kidneys, it takes a lot of water with it. So then you're more prone to dehydration and dry skin. You might find yourself also being increasingly hungry. Okay, so what that is oftentimes is that insulin level is starting to increase, and then that can stimulate hunger, and so you might find yourself eating more. There might be weight loss or there might be weight gain. So both of these things can happen. We talked about increase in thirst because you're urinating so much, and so you're drinking a lot. Another change that you can notice in the skin is that there's a darkening that happens here. There's a darkening and the roughness and the different change in quality that can happen on the neck or underneath the arms. That may indicate a diabetic or a pre-diabetic condition. So those are some of the symptoms of increasing fatigue because you're not using your blood sugar appropriately for energy. So you're feeling increasingly tired, and you might feel that you want to sleep all the time. So those are some symptoms of diabetes. You might also start experiencing numbness and tingling in the hands and the feet. And that could be then blood sugar now is starting to impact it. The high blood sugars are starting to impact the nerves in the hands and the feet, and that's usually referred to as a peripheral neuropathy. So those are some of the symptoms of of diabetes. So how does your doctor diagnose you with diabetes? Let's say you go into your doctor and you say, I'm having some of these symptoms, and of course he or she is concerned about diabetes, and you, after listening to it, are concerned as well. How do they diagnose that? Well, usually blood work is required for that. And so the blood sugar level is elevated, and right now it's the magical number seems to be 126. If it's consistently fasting blood sugar level, that means before you've eaten anything and overnight fasting, the blood sugar level would be about 126 or above. That's considered diabetic. There is something called a hemoglobin A1C. You don't have to remember this. This is not a test, but it's a special test that's done to see the average of your blood sugar the 3 months prior to the test. And so oftentimes, while the fasting blood sugar level can be confusing or misleading, that special test called the hemoglobin A1C gives you an average of what the blood sugar was for the previous 3 months. So it's much more difficult to misinterpret that test. And that's a more specific test. That test is also used, a special test is also used to see how well your diabetes is being controlled. Let's say you were started on treatments. So those are the usual special tests that are used. Now for sometimes, your blood sugar level can be normal. Your fasting blood sugar level can be normal, and you can still have diabetes. And that is why your doctor will sometimes do that additional special test to really ensure that you don't. A special test that I do also is I tend to want to measure the insulin level as well, because I don't want you to be insulin resistance, because we talked about how too high of an insulin level can also cause some of the problems that diabetes can cause, right? And so it's important to, and sometimes that happens before the diagnosis of diabetes. So your blood sugar level sometimes can be normal, but your fasting insulin level, or the insulin level before you've eaten anything, can be elevated, okay? So that is primarily one of the ways. And of course, he or she will also check your blood pressure to see that it's not impacting that. We'll also make sure your kidneys are still functioning normally, because diabetes can cause some changes in the kidneys. We'll also check your urine to make sure that there's not a lot of urine sugar. There should be no sugar in the urine on the urine test. So those are some of the ways that they can diagnose diabetes. Okay, so what are some risk factors? Now we know some of the symptoms and how your doctor diagnoses. What puts someone at risk for diabetes? So our eating habits and our lifestyle can put us at risk. Okay, so when we eat, especially if we're genetically susceptible, so for those of us, refined carbohydrates, or carbohydrates get metabolized very easily, or gets broken down to simple sugars very easily, causes the body to respond in a way that sends out a lot of insulin. And sometimes what happens is that so much insulin is sent out that the blood sugar drops significantly, and you can develop hypoglycemia. And sometimes hypoglycemia might be an indication that your body's not metabolizing sugars well, and may be concerning for future increased risk of developing diabetes and insulin resistance. So we know that our diets that are low in fiber, diets that are high in sugar, diets that are high in high fructose corn syrup, diets that are high in trans fats, these things can predispose us to developing diabetes. But did you also know that there are some studies out there, and very solid, respectable studies, that said there's a certain compound that's contained in plastics that can predispose us? Well, plastics like the water bottles that you have, or plastic cups, that can predispose us to diabetes by interfering with the way our endocrine system, which diabetes is part of that system, interfering with the way that works. Other things that can predispose us to diabetes, increase in weight, or because again, fat cells can generate a lot of inflammation, and inflammation can predispose us to diabetes. At least that's one of the ways that we think that this can happen. Sedentary lifestyle, because exercise actually helps us to metabolize sugar well, independent of insulin, meaning that exercise can do this without the help of insulin. So when you have insulin doing a good job and exercise doing a good job and exercise making it easier for insulin to do a good job, then you can see why a lack of exercise would be a risk factor for developing a diabetes. So many of us, I do know, sometimes the way we've grown up, there's certain things we've been eating, or now that we're adults and we have more of a sedentary lifestyle because our jobs require us to perhaps be in front of the computers, we have more television time, we have more screen time, we're sort of increasing a risk of developing diabetes, and we're starting to see it in younger children. And usually when that happens, we think, oh, it's juvenile diabetes or diabetes type 1, which is an autoimmune condition. But in recently, it's been actually diabetes type 2. And we're also starting to see, because of that, a condition called fatty liver, where the liver cells become, instead of being liver cells, they're kind of overtaken by fat, and so the liver is not as efficient at doing its job. And remember, the liver is super important when it comes to managing blood sugars well. So what can we do about it? The question is diabetes reversible? Can it be cured? Is there a difference between reversible and being cured? So the answer to that is yes. Actually, lifestyle modifications have been shown to reverse the signs and symptoms of diabetes and bring the blood sugar level and the insulin levels back into control. Some people have even been able, who have started medications for it, some people have even been able to stop medications based on some lifestyle changes, and it's actually recommended as not only the first line of treatment, but also part of any treatment that you do, or some lifestyle modifications. So the difference, though, between reversible and cured is what I have noticed is that when many people use the word cure, they expect the association with that is that they can no longer acquire this illness, and that is not true. The same things that allowed your body to develop diabetes in the first place, if you go back to those habits, your body will go back to acting in a diabetic way. So cure does not mean that we can resume the habits that created the issue in the first place. But it can be reversed, and we need to be consistent with the things that put the body back into a healthy state. And then we can enjoy a life of diabetes reversal. So what are some of the things that can help you to manage blood sugars well? Well, we already talked about a few things. We talked about exercise, because exercise helps insulin to work better. It helps insulin to open those doors better, and exercise uses other doors to get glucose into the cells, right? So it doesn't have to depend on just the doors that insulin uses. Exercise has its own special doors that it can also use to get glucose into the cells that need it, take it out of the bloodstream where it can't get to other places and damage it, okay? So exercise is important. Sleep. People who do not sleep, it only takes 1 week, actually, of not sleeping well to increase your risk of developing diabetes. That's really interesting to know. So getting good sleep also helps with that. And of course, what we eat is important. Now, do not tune me out here. This is very important. This is probably the most foundational thing when it comes to reversing or even improving your diabetic management, whether you're on medications, not on medications, using lifestyle primarily to control it. It's really important. Focusing on foods that are high in fiber acts in several ways. It helps decrease the rate at which sugar is released into the blood. So insulin does not have to go up very high because it's a slow release. So it does help to decrease our risk of diabetes. It's also helped the probiotics in our stomach to really work better because that's their food as well. We know foods that are high in antioxidant values and a vitamin called alpha lipoic acid. So like things like Brussels sprouts and the green leafy vegetables, those have been shown to also decrease risk of diabetes and perhaps even help with diabetes reversal. Intermittent fasting, which we talked about, I think it was one of our first or second discussions. Intermittent fasting, some studies using intermittent fasting has noticed that there's been some reversal in that, and that's because there's some changes that happens with that. So there's several chemicals that are released during intermittent fasting, and also it allows the body then to, and it also gives the body room to rest and regenerate and gives insulin, so insulin does not have to increase that much. There have been also some studies, and we talked about a ketogenic diet as well. I usually like to think of it as more of a modified, but there's some studies that have shown that that type of eating may also help some individuals. And I believe, again, it's because it really does steer them away from using simple carbohydrates, steer you towards we need healthy fats, because healthy fats can decrease inflammation and helps the blood cells to the body cells to communicate better. So these are all things that we really can help us to improve diabetes, perhaps even reverse diabetes. So lifestyle really is important. Now, if you are having challenges with that, your physician may start you on medications, and there's several medications available, and these are things that you can, of course, must talk about with your physician. The most common one is something called metformin, and that works more on improving the way that your body uses insulin so that blood sugar improves better, and that really has less of a possible concern about blood sugar decreasing to very low levels. That can be an issue as well. So some of the complications from diabetes we talked about, but also there are some possible complications from diabetic treatments as well. So this is something that you need to go over with your physician. Because some diabetic treatments, there's concern about blood sugars being too low. Diabetics can also have blood sugars go too low even when they're not in treatments in the initial stages of this condition. So I know we said a mouthful, and I've probably been talking a lot, and you probably have a lot of questions. And this is the time to ask those questions as specific as you want to be, because I want to help you to start creating a plan for yourself. I want to help you to perhaps maybe even start identifying if you are concerned about diabetes, if you are at risk for diabetes, if you're starting to have some symptoms of diabetes, because it's really important. The earlier you intervene into this condition, the better off you are. The better your chances of reducing the damage that can be done because of this very, very common condition. So I'm going to take this time to say hi to some of the people who've joined us today. I'm sorry initially about the initial video again. It seemed some people were not able to connect, so I just restarted the video. The first half of the video is good. There was an interesting tip on it about if you can do 5 minutes of an exercise that doesn't involve you jogging or lifting any heavy weights or cycling for 2 hours that would decrease your risk of heart disease, increase your ability to think clearly, and increase your stamina, would you do it? And the answer is yes, there is. 5 minutes of using something called incentive spirometry, which is taking deep breaths against resistance. And there's a special a tool that helps us to do that. That's readily available. 5 minutes a day can actually help you to accomplish all these things. So when you actually start exercising, you have better stamina. You're able to do more. It increases your ability to exercise and may actually even decrease your blood pressure as well. So that's a little tip to end on. So let me look at some of the people who are here and say hi to them. So hi, Ms. Rogers. Oh, as always, it is good to see you. And thank you for joining us. Let me see if anybody has any questions. Let's see. We have Deborah Perkins who's joined us. Thank you. I want to know if anybody has any questions. So if you don't have any questions, then I will absolutely, if you have any questions, I will answer them. If you don't have any questions, that's fine too. We'll talk again next week. Remember, you can always email them to me, and I will be happy to respond to them either via email or during our next Facebook Live. So, and hopefully the next one goes super smoothly because we deserve that. Hi, Mary. Okay, so it doesn't look like we have any questions currently. I think everybody might just be processing. I know there's also a delay oftentimes. Some of the things that we can talk about while we are waiting to see if there are any comments, there might be things like we talked a brief bit about alpha lipoic acid, and I think you're probably wondering, gee, what is that? Well, believe it or not, that's a vitamin in the body and in foods that can actually help us to metabolize sugars better. And you might also notice that it's a supplement that's sold in stores as well. Now, I would like to let you know that even if you are using medications or you are on any kind of supplements for diabetes, I like to also encourage you to enhance that with a change of lifestyle, because it's really important and it's foundational. You don't want to continue to add fuel onto the fire while you're trying to put it out. That makes it very, very difficult to put out the fire that is diabetes. And any firefighter can tell you that that's not the way that you go about fighting a fire, by keep pouring fuel, and the fuel would be continuing habits that generated that condition in the first place. You don't want to do that. You want to actually create conditions that helps whatever that you're doing to work better. Okay? So that's the ultimate goal with this. Okay, so some of the symptoms, and we're asked to explain some of the symptoms of diabetes. So we talked about some of them. We talked about increased frequency of urination. So that means you're going to the bathroom a lot, like you have to pee all the time, right? You have to pee all the time is what it means. And so ultimately that's because when the blood sugar gets high, creates something that we call an osmotic effect, and basically it draws water to it, and there's a lot of blood sugar going through the kidneys because the kidneys are trying to help you out, and so what happens is then you urinate a lot. You tend to pee a lot with it, so you become dehydrated and you become very, very thirsty. So you might find yourself drinking just a lot more water than you usually do, even if you might find yourself drinking a lot more water. So increased thirst, you might have weight loss or weight gain. That can be a symptom as well. The interesting thing is that the numbness in the hands and the feet can occur sometimes. That might be a first sign that a person has that their blood sugar is not being well controlled. And so that's because the nerves in the hands and the feet are starting to get damaged by the blood sugar. And that one you want to take care of relatively quickly, because then that can become then painful. And a diabetic neuropathy is that what that's referred to, and that can be very, very painful, very, very uncomfortable. So those are some dry skin. Remember, we talked about your skin, of course, because you're dehydrating, and then the skin changes that can happen in the folds of the neck. You might notice oftentimes I can notice those skin changes on some of my patients that may not even be aware that they're at risk for diabetes. So that's important. Those skin changes can be under the arms as well. So these are some of the signs and clues and symptoms that diabetes, that you or someone that you love should be checked for diabetes. So there is a hereditary component. So I'm having some questions here, and some of you might have joined later. So we're having these questions. There can be a genetic component to diabetes, but here's the interesting thing is that oftentimes it's more the environment that you put that activate these genes that are susceptible to diabetes. So if these genes are placed in the correct environment, oftentimes diabetes is not triggered. So while you may have a family history, keep in mind also a family history may be because that family grew up eating similar things, and so there's been a similar environment that can trigger those diabetic genes. So sometimes you can turn these genes off. Yes, believe it or not, you can turn genes off with a good environment. And so the types of diet that we talked about before that could improve, help to improve diabetes and improve blood sugar, we want to talk about some things that are high in fiber, good fats, so things and high in high vegetable content, a higher of the lowest sugar fruit content, such as blueberries and strawberries. You will find that in the Mediterranean diet. And I love the Mediterranean diet. My daughter tells me I talk about it all the time. You would find that in the Mediterranean diet way of eating. There's also many people focus on a low glycemic diet, but sometimes low glycemic foods are not necessarily a low glycemic diet is not comprehensive enough. Some studies have shown that intermittent fasting, and what that means, we talked about that before. It will be too lengthy to go over the entire thing again, but intermittent fasting is like a period of fasting, usually about 16 hours or more, 16 hours intermittently. And so that may be stopping last meal at 6 and then resuming again in the morning about 9 or so. And then also this might be it might be intermittent fasting, might be a day of fasting. It doesn't mean, water intake, etc. Can do that. Weight loss, of course, losing 5 to 10% of your body weight can actually start improving your numbers as well. So those are some things that you can do to help to improve that condition. And so healthy eating does not have to be confusing at all. It really means, I just encourage people initially just start adding more and more vegetables into your diet. Start there. Just starting more and more vegetables into your diet. Once you start that, you will notice that you're starting to feel full, you're starting to feel better, you're starting to give yourself more fiber, blood sugars might start improving, and then you can gradually start making other changes. Absolutely remove low glycemic foods or foods that are simple carbohydrates or sweets. Let's just call it what it is, sweet stuff. Donuts and cakes and cookies. Those things initially need to be removed from the diet until you've got things under control, and then you may have it occasionally. But again, keep in mind, reversal is and cures does not mean that you can start doing the same things again. So if you start getting your blood sugars under control using lifestyle, and you've lost weight, and you start exercising, and you start eating certain the right foods, do not go back to doing the things that cause this condition to reveal itself in the first place. Okay, so let's see. Great. Well, thank you guys for tuning in and listening. And if you have any questions, again, please feel free to shoot me. Go ahead and ask them on Facebook, and I will respond to you either on Facebook or in private messaging, or of course next time if we have any questions that we need to address, we can do that before we start our next, and that will be Wednesday at 7:30 next week, and we hope to have it all together and everything will run smoothly. So until then, thank you for joining me and have a great night. Bye-bye.